If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Hello everybody and welcome to this week's episode of Don't Tell Me to Relax. Today I am joined by Alejandra, who is an integrative psychotherapist. She has completed an undergraduate at Oxford and Georgetown, and she has a master's degree in integrative counselling and psychotherapy from Regent's University. And I asked her to come in today to speak to us because mental health and fertility are such huge topics, and I feel like it's been such an area that hasn't been discussed enough and hasn't been given enough support or airtime. And I do think that is changing. It's definitely something that we see in our clinic. And obviously, we are not psychotherapists, we are not counsellors, we are acupuncturists. And so we often refer people on should we feel that they need it. And so I thought it would be really good to discuss today what we actually mean by counselling, psychotherapy, coaching, because there's a lot of information out there and there's a lot of ways to look after your mental health. And sometimes I feel like it can be quite overwhelming of knowing where to start. So, Alejandro, do you want to introduce yourself first of all and say hello, and then we'll get stuck into the podcast?
Yeah, hello. It's a pleasure to join you, and I love your podcast. So it's great to be part of it, and thank you for inviting me.
So you work with clients who have problems with fertility, antenatal issues, gynecological issues, clients facing pregnancy loss, high-risk pregnancy, birth trauma, primary ovarian insufficiency, unexplained infertility, IVF, endometriosis, PCOS. So we have a real crossover, what you see in your clinic compared to, as well as what I see in my clinic. So as a psychotherapist, can you tell us, what is the difference between psychotherapy, psychology, counseling, coaching? How does it differ?
Yeah, I know, and it's such a shame that we make it so complicated for clients, right? But basically, so yes, you have mentioned the four that get often confused. I'll start with the easier one, which is psychologists. There are different types of psychologists, but the majority train through the NHS, so they are mainly associated to the NHS, and they work in hospitals. They do assessments, and they also do CBT techniques and others. A lot of them also focus on conducting research. So most of your clients will not be looking at psychologists, I think. The majority, as I said, are part of the NHS. We're left with three. So the coaches, psychotherapists, and counselors. Coaches also I'll take aside because coaches generally don't train on emotional issues or how to deal with issues such as depression, anxiety, trauma, etc. They are very focused on specific objectives. A lot of coaches, for example, are professional coaches. They work with individuals that are looking to change jobs or that are looking for a promotion. In terms of fertility, my understanding, and I'm not an expert on coaches, is that they focus on techniques. So how to relax, what to do during the 2-week period of waiting. So looking at techniques that can help the client relax, feel better, improve their well-being. So they're very focused on that. So, for example, what types of exercises to do, what techniques for relaxation to use, etc. So they are not mental health professionals per se, but they are very supportive for clients that are dealing with a difficult, with a specific goal or a difficult situation. Then we're left with psychologists, psychotherapists, and counselors, and we are very similar. We train in a different way. So a psychotherapist trains between 4 and 6 years. A counselor trains for between 2 and 3 years, and the counselor is typically focused more on more superficial, if I may use that word, issues. They don't go so deep, so they might work with clients that are dealing with work stress or other type of issues that don't go as deep. And the and for that reason, they work with the clients shorter term, generally for about they count in weeks, so 12 weeks, 20 weeks or so. A psychotherapist will look into an issue at a much deeper level. So if we're working with somebody dealing with anxiety related to fertility, for example, we'll go much deeper to understand if there is anything else behind the anxiety that we have to consider. We will, if they are dealing with depression, similarly, and we also deal with a little bit more of a complex presentation. So if it is not just anxiety, but anxiety and depression and trauma, so a little bit more of a complex presentation. And we work with clients, we can work with clients on a just for short term, but generally I say we count in months and sometimes in years.
So it's kind of long-term work.
As I said, not necessarily. Sometimes it is shorter. If we with the client decide that we're just going to work on something very specific, but generally it is, especially with fertility clients, it is months. And if it is an issue that is complex, or if the person is going for fertility treatment for a long time, it can be years. Also, something to say is that all the clinics, fertility clinics licensed by the HFEA, must offer one session with a counselor before individuals start treatment. So that's where you see the counselor, and it is one session. So you can see that counselors really generally work a little bit more shorter term. Now, I have to say that I'm speaking as a psychotherapist, so I have my own biases about how I see different ways of working. There are some counselors that have years and years of experience, and if you go and work with them, they will the type of work will feel very similar as working with a psychotherapist. So it will be a little bit deeper. At the end, I think what should matter to your clients is whether the professional is registered with the right organizations and has the right training, so they can ask, are you a counselor, are you a psychotherapist, but where are you registered, how have you trained, what is your approach. So I think that is maybe what your clients might want to take away.
Yes. And I think that, this idea that in the IVF clinics, really the everybody is offered counselling, but I would say that it's not enough
No, yeah, I
to
agree.
really go into, or really, I mean, I know lots of people who've used the counsellors and said it's been very helpful, but it's not long enough or enough kind of one-to-one contact to really make difference in the long term, I would say.
Yes, I agree. I mean, one session is just to say hello. I mean, you don't really get into the depth of the issues.
Yeah. And so can you tell us, what is the impact on fertility for our mental health? I mean, there's lots of studies out there, more information coming out all the time, but what do you think the impacts of fertility struggles are on our mental health?
Yeah, it is. The impact is huge, and it's unfortunately very overlooked. So when we talk about fertility, there's so many fertility clinics, but and they focus on how to get pregnant, or how to have a child, but not the impact that the journey has on the mental health of the individuals. And as you said, there is so many studies that show that there is a very important impact. So one recent study conducted here in the UK found that 90% of women going through a fertility treatment feel depressed.
Mm.
40% had experienced suicidal feelings, and 10% were struggling with suicidal thoughts often or all the time. So the numbers are really, really important. Anxiety is another mental health challenge experienced by women undergoing IVF, and research shows that about 20 to 35% of women undergoing IVF report symptoms of anxiety. I actually think that that number really is a little bit low for my experience in speaking to professionals like you. In terms of men, there is also the fertility also, of course, has an impact on them. So one study from about 5 years ago showed that as many as 93% of men report that their well-being has been affected by the experience of infertility. So as you can see, we're talking about 98%, 90%. So the numbers are very high, and in my practice it just feels that the impact is very, very profound, very destabilizing for individuals. I don't know if that is your experience too.
Yeah, absolutely it is. And I find that a lot of the time when people are going through IVF, like exactly like you said, there is a lot of focus on the practicalities of getting through that treatment.
Mm-hmm.
And often the role that we fill, or the role that we have a lot of the time, is to kind of validate people's feelings around feeling anxious, feeling stressed, feeling depressed, feeling completely lost and overwhelmed. Because often that is, it's not that the IVF clinics don't realize it, it's just that there
Yes,
isn't a lot of time or space for that conversation to be had.
absolutely.
It's very much focused on the needles, it's focused on the injections, the drugs, the protocols, all of those kind of things. So, something that I say in clinic a lot is, this is one of the most difficult things you can ever go through in your life.
I agree.
Because and just saying that, just kind of giving that kind of validation to somebody can be really helpful. Obviously, I'm not a trained counselor, but I find that, we do spend an hour with each appointment, sit with people while they have their needles in. We always have a conversation, and it's just kind of giving that space for people to discuss how they're feeling, and to say, this is normal how you're feeling. Of course you feel anxious, of course you feel depressed, or you feel cut off from the rest of your family, because this is really, really difficult. Can you sort of explain to us, why does fertility have such a profound impact on people? What is it about a fertility problem that is so huge?
Yeah, absolutely. So there are different reasons that why going through a fertility journey has an impact on individuals' mental health. W- First, I think we have to take into account the physical stressors. So people or women that are going through IVF they're going to be going through hormonal treatments, and those hormonal treatments do have an impact. So, for example, there are some very commonly prescribed medications such as clomiphene or HMG, and studies show that those medications have an impact on women taking them. So 40 to 60% of them experience side effects such as mood swings, irritability, or feeling down. So there is a physical component to that we cannot discuss. Also, the treatments in themselves are very invasive. So for women and men going through or gender nonconforming going through a fertility treatment, they're going to be going through so many tests, and they're going to be probed and scanned and having blood tests all the time, and that in itself is also very uncomfortable. So that adds to the mental health difficulties. From the emotional perspective, going through a fertility journey challenges individuals' image of how they thought that their life will look like. So they start to question, the life that I imagine, will it actually look the way I'm imagining, or not? And coping with that uncertainty, or having that image shaking, it's very destabilizing and overwhelming. um, so there's that. Also, going through a fertility journey involves a lot of grieving, and it's not just the grief associated to miscarriages, pregnancy losses, but it's also emotional grieving. So you're grieving uh, um, a, a fertility journey that you imagine you will have, but you're actually not having. You are grieving for belonging to a community of friends that are having children, and you're not. So there are different levels of that grief. Is not just grieving for pregnancy losses. Infertility can also challenge individual self-esteem and sense of self before the infertility difficulties. Person feels able, they feel that their bodies are able, I can conquer, I can run, I can do this, I can do that, and then they see that there is something that they are not able to accomplish, and that really hurts their self-esteem and sense of self, and they start doubting their bodies and themselves. There's also a connection between fertility and sexuality. So some individuals might feel a sense of inadequacy or failure if they are not, from a sexual perspective, if they are not able to conceive. There's also the fertility journey can cause tension between partners. If there is a couple going through the journey, they might experience issues in terms of the communication and different ideas about the fertility journey, when to stop, whether to try a different approach, and so forth. So that also has an impact on mental health. Lastly, it is a journey that it is very isolating. So people, it's not a conversation that we have very frequently. The people feel that they can discuss the fertility journey with their friends or family. It is deeply personal, and so people might feel isolated, and that is also adds to the mental health difficulties. I could keep going on and on,
Mm.
but you see that there is so much. There is grieving. There is challenge to self-esteem. Considerations from the sexual perspective, relational issues. So it makes sense that people feel that this fertility journey impacts their mental health.
Yeah, absolutely. And I think the thing that I see a lot and we discuss a lot is that, and you've rightly said there, is that it actually impacts every single area of life.
Yeah.
There's not a part of life, whether it's work, your friendships, whether you go on holiday, taking a mini break. It's like every single decision and aspect of life can be influenced by the fertility journey, the fertility decisions, where you are in treatment, and it's overwhelming.
hmm Absolutely. Yeah, you put it very well. It impacts every aspect of your life.
Mm.
Absolutely.
So, what do you think? Because I'm always interested, and I do ask the question quite a lot on this podcast. Is what is your opinion about stress and its impact on fertility? Because I've had people come on here saying stress does not impact fertility, and then I've had people saying we don't know, and then I'm interested to hear what you have to say.
Yeah, I think that the relationship between fertility and stress is very complex and not fully understood. So there is research that shows that high levels of stress, specifically chronic stress, might affect fertility by disrupting hormonal balances in ovulations. In ovulation, other studies suggest that stress does not have an impact on fertility. I saw a study just last month about men, anxiety, and IVF outcomes, and the result was that the level of anxiety had no impact, no relation. There was no correlation between the level of anxiety and the IVF outcome. So every month we see a different study, and they show different things, different results. But I think regardless of, while we're studying this, I think that it is not helpful to keep telling women to just try to relax to get pregnant. And that's why I love the title of your podcast, because we don't know the relationship, and to
Mm,
just tell women just relax and you will get pregnant, that just oversimplifies a very complex issue. It fertility struggles are caused by a variety of factors. It's not that stress will cause infertility. There is a variety of factors that can have an impact on infertility: hormonal imbalances, genetic issues, so many different issues. So it is the idea of just try to relax and you will pregnant is, I think, damaging. It puts unnecessary stress and pressure on individuals that are going through the journey. In some way, it seems like it blames them, that they're doing something wrong. They're stressing, and that is why they are not having a child, and that is absolutely incorrect.
mm,
Being stressed is absolutely, as we're discussing, being stressed is absolutely understandable during a fertility journey. The emotion matches the experience. If you were going through a fertility journey and you were not stressed, I will think there is something there to look at. It probably a lot of repression, suppression. It makes sense to be stressed during a fertility journey. Now, that doesn't mean that we have to tell our clients to abandon themselves to the emotion of stress. I always think that there's two extremes when we're thinking about emotions. One extreme is absolute repression. We don't really think about emotion. We don't talk about the emotion. And the other extreme is abandoning ourselves to the emotion. So we feel sad, so we just cry and cry and cry and cry. So I think those are two extremes. And through psychotherapy, what we try to find is a balance, a place in the middle where we engage with the emotions, but in an intelligent way. So we understand the anxiety, we understand the stress, but we do it not abandoning ourselves to that emotion, but really trying to explore it and finding ways to reframe it, tolerate it, manage it.
mm. So can you tell us a little bit more about the sort of specifics about how therapy can help with a fertility journey?
Yeah, absolutely. So the way I explain how I work is that when I'm working with a client, I'm always conscious of three different layers. So the top layer is the most superficial layer. So this is where I am helping a client with tools and techniques that will make their day to day better. So if they are dealing with anxiety, if they are really stressed about the outcomes of fertility, there are very specific tools or techniques that will help them with that. If they have gone through a miscarriage, a very high percent of women that go through miscarriage show signs of PTSD. So there are specific protocols to deals with flashbacks, to deals with thoughts, memories related to those experiences. So in this very top superficial layer, we talk about the tools and techniques. Now, I don't think that is psychotherapy. That is just kind of like a band-aid, something that we use today to make the day-to-day of the client more bearable,
Mm,
more comfortable. So that's the top layer. Depending on the client, that might be about 5% of the time, or a little bit more, a little bit less. It also depends on where the client is in the journey. So that's the top layer. That's how it helps. The second layer of psychotherapy is the talking. We sit and we talk about how they are feeling, and that helps in two ways. One is it offers an opportunity for catharsis. So the person might be holding on to emotions such as anxiety or others. They might feel this pressure on their chest or like this dark cloud over their heads, but they actually haven't had an opportunity to really, really open up about their emotions. So in our conversations, we talk about how they feel, and we start naming the emotions. So is it anger? Is it disappointment? Is it grief? Is it sadness? And we start unpacking those emotions, and in that, this catharsis happens. So they open up and they feel a little bit that those emotions soften once they talk about it. Talking also helps because it provides us with insight. So when we're talking about it, we might be talking about grief. We might make connections about, oh, this is actually triggering past grief, or it might be triggering anxiety that we have felt since we were young. So the experience of anxiety is familiar to that person. So that's something we might have to talk about. So it offers us insight into why the client is responding to the fertility journey in the way they are. And I believe that we need to know that in order to address it. Because just to say you're anxious, okay, let's breathe in, let's breathe out, whatever exercise we'll do, will not offer long lasting effects. We need to understand a little bit more about that anxiety, whether there is something in the past or in the present that is contributing to the anxiety. And once we understand it in a deeper way, then I think that feeling that might shift a little bit. So
Mm.
that's the second layer. The third layer is the relationship between the client and the psychotherapist. And all of the research shows that that relationship is actually the most important element in psychotherapy. And the way I like to explain it is that, hopefully, when you are with someone that you love, if you feel a physical pain or an emotional pain, if you are with someone that you love, that cares for you and accepts you, doesn't judge you, something will shift. Even if they don't speak, even if they don't touch you, just sitting next to them, something will feel different. And at its best, this is what you should be getting from psychotherapy. Like, you go to a place where you can be with someone and you feel that you are completely cared for, and that the person is not judging you, is giving you a space to speak, is helping you understand what you're going through. And that experience in itself can be very healing. So those are the three ways in which I think psychotherapy can help.
Mm. So it's very, very powerful technique.
Uh, yeah, it's a very powerful. I'll use the word process.
Okay,
The,
process.
yes, because the technique is associated to this top layer, the
Mm.
superficial, the tools and techniques. But I think it is a very powerful process. Of course, I'm a psychotherapist, so I believe I say I not only drink the Kool-Aid, I make the Kool-Aid.
And just sort of following on from that, how does, if somebody's listening to this and they're thinking, okay, how do I find a psychotherapist to work with? Where would you recommend people go? How do they go about that?
Yep. So there are many different. If there are many places that they can go. So there we psychotherapists, we are accredited by two main bodies. One is called BACP and the other one is called UKCP. So they can go to those websites and they will find psychotherapists in both sides. In the BACP side, you will find counselors and psychotherapists. On the UKCP side, you will find only psychotherapists. Then there is another organization. It's called BICA, and in BICA you have also counselors and psychotherapists that have some additional, not some, but they have extensive training and experience working with individuals that are going through a fertility journey. There on BICA, you can find also both counselors and psychotherapists. And if you want to find more about the work of my organization, the name is Fertility Support, and our website is fertilitysupportlondon.com. And we are a group of about 10 psychotherapists, and we specialize in fertility related issues. We are the only practice in the UK that focuses on fertility and gynecological issues, because we work as a group. We have individual psychotherapists, couple psychotherapists, and we work together on these issues. And as I said, it's the only one in the UK. The other psychotherapists and counselors work independently on these issues, but we are a group, and that has benefits because we continuously talk about our work and hopefully advance the knowledge about this very important issue.
And do you think that it is important for somebody to speak or work with somebody who has that specialism in fertility as well? Or do you think that is it a case by case basis and it's based on the relationship between the therapist and the person seeking the therapy?
I think I would say it's case by case. I don't think
Mm,
you need to go to somebody that specializes. They're excellent psychotherapists that don't specialize in fertility, and going to them will, it will definitely help, especially if you have experience working with a psychotherapist in the past and you want to go back to that psychotherapist. You don't have to change. You can stay with that person. That makes absolute sense. I think the only benefit of the benefit of working with somebody that has experience in fertility is that we, especially as when we are uh, registered with Bika, we go through very specific training related to fertility. So then the client doesn't have to explain us um, medical or legal implications of their fertility journey. We understand and we're very much on top of what the research says about those issues, and I think that because we see that day in and day out, we can also help validate a lot of the emotions. We know how the journey looks like, and that might make the work a little bit. The client might not have to explain as much, because
mm,
we see those issues day to day. But I don't think that a psychotherapist or counselor that doesn't focus on fertility wouldn't be able to help. I think that I'm
mm.
sure they would.
Yeah, it's interesting because people often ask me whether they need to see an acupuncturist who specializes in fertility in the same way. And
Mm-hmm.
I always say, well, acupuncture is acupuncture at the end of the day. Treatment, if you benefit and feel better from it, that's the acupuncture. So, but it is good sometimes to have that specialist knowledge because you can really understand where the person is in IVF. You may understand the drug protocol they're on, the side effects of the drugs. All of those extra
Yes.
knowledge can help, can't it? But it's not 100% necessary. I often say it's about finding a person you really connect with can be really important, as well as that having that specialism knowledge.
Yeah, no, I agree with you with what you said about acupuncture is acupuncture, and it helps. I will say use the same phrase. Uh,
Yeah.
I'll take that from you. Psychotherapy, psychotherapy. So it helps, but as you said, like we are very aware of certain things that other psychotherapists might not be aware, like the cycle. Like we're holding that in the back of our minds where the client is in the cycle. We very much understand the IVF process,
Mm,
the different stages of it, the scans, if there are any specific procedures that the client is going through. They don't need to explain that to us.
yeah.
We understand. Hopefully.
And Alessandra, do you work online as well as in face to face? Do you offer both types of appointments?
Yes, in the practice we have, as I said, 10 psychotherapists. Our
Yeah.
practice is on High Street, Kensington. So that's where we work in person, but we also work online. So we have a couple of psychotherapists that only work online. I personally work 3 days a week in person and 2 days a week online.
Okay, that's great because I guess lots of people listen to this who are not London or South based. So it'll be good to be able to put up your details and know that it's accessible for everybody listening.
Yes, and your practice and my practice is not that far away, so we're in the same area.
Yeah.
Yeah.
Okay, well, thank you so much for your time today. It's been absolutely fascinating. And it's so interesting to hear about the different types of therapy that are out there and the way that you work with clients. I think is really useful to understand because often I think people don't necessarily realize what what it is and how it can help and what levels to work on. So it's really helpful to hear that. So thank you very much. I will put all the references and all your details and all the organizations. I mean, counselors and therapists are as confusing as acupuncturists, in terms of making it easy for people to understand. But I will put all the details on there so people can have a look.
Great. Thank you so much for the invitation. It's been a pleasure to speak with you. And I think it's so important that, we continue the conversation about mental health. It is a taboo, unfortunately, in our society. Luckily, it's more open. More people are talking about their mental health difficulties. With infertility, I think it's even a greater taboo. So I think it's very important that we continue this conversation. So thank you for having me.
You're very welcome. Thank you.
Thank you.
If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.